Simplified summary. Drug class, muscarinic agonists, e.g. Bethanechol. Mechanism, stimulates M3 receptors on the detrusor muscle of the bladder, causes contraction, promotes bladder emptying. Used for urinary retention, especially after surgery or childbirth when the bladder can't empty. USMLE style questions. Question 1. A 62-year-old woman has not been able to urinate for 10 hours after abdominal surgery. She has a distended bladder on physical exam. Which of the following drugs would be most helpful? A. Oxybutynin, B. Bethanechol, C. Tamsulosin, D. Phenylephrine, E. Tolterodine. Correct answer B. Explanation? Bethanechol is a muscarinic agonist that stimulates M3 receptors in the bladder, causing detrusor muscle contraction and promoting urination. It is used in urinary retention with no obstruction. Why not the others? A. Oxybutynin is an M3 antagonist used for overactive bladder. C. Tamsulosin relaxes the prostate and bladder neck, useful in BPH, not post-op retention. D. Phenylephrine is an alpha-1 agonist, causes vasoconstriction, not used for urinary retention. E. Tolterodine is a muscarinic antagonist, also used for overactive bladder. Question 2. Which of the following best describes the action of Bethanechol on the bladder? A. Blocks alpha-1 receptors at the internal sphincter. B. Inhibits sympathetic tone to relax the bladder. C. Activates nicotinic receptors at the external sphincter. D. Stimulates parasympathetic receptors to contract detrusor muscle. E. Inhibits acetylcholinesterase to increase acetylcholine levels. Correct answer D. Stimulates parasympathetic receptors to contract detrusor muscle. Explanation: Bethanechol is a direct muscarinic agonist. It mimics acetylcholine and stimulates parasympathetic M3 receptors on the detrusor muscle, leading to bladder contraction and urination. Why not the others? A. Alpha-1 is involved in sphincter contraction, but Bethanechol doesn't affect it. B. Bethanechol doesn't inhibit the sympathetic system directly. C. Nicotinic receptors are involved in somatic control of external sphincter, not detrusor. E. That's the mechanism of drugs like neostigmine, not Bethanechol. Let me know if you want a comparison with